my name is Bianca Nunez, and I'm a full-time nursing student at Nevada State College, and I'm here today with my professor Marcellus. So for today's situation, we have a patient in room 12. Her name is Monique Rogers. Her date of birth is 9/10/87. She's a 32-year-old female who was admitted today for right ear pain. This pain's been going on for about 3 days now, and she started seeing these symptoms after she went swimming about a week ago. So a little background about Monique. She has no allergies that we are aware of at this time. As for her current illnesses, she doesn't have any medical illnesses that we need to be aware of. She's just currently having the right ear problems. As for past history, she's had a situation like this before in high school with the ear problem. But nothing else besides the one she had in high school. As for family history, she doesn't have any family members who have history of ear problems. As for her occupation, the patient works as a licensed practical nurse, but she doesn't work in a surrounding area where it's very loud that can damage the ears. So I did some assessments on her today. So today I took her vitals and I assessed her eyes, nose, and ears. So for vitals, the patient's temperature was a 98.7 Fahrenheit. Her blood pressure was 120/80. Her respirations were 16. As for her pulse ox, it was a 98%. And for her pain, it was a 7. The patient, she did appear to be alert and orientated to place on time. Also, the patient, for her eyes, I did some inspection. The patient's sclera appeared to be white. Her eyes were brown. There was no discharge noted. She did wear corrective lenses, so she does wear glasses. There was no abnormalities present. I did some palpations on the lacrimal glands to see if there was any tenderness, and there was none noted. I also did some tests for the eyes. I did a near vision test, and I also did a light to accommodation test as well as visual fields. So for the near vision test, the patient got a 20 out of 30 vision. For light to accommodation, her pupils were equal, round, and reactive to light and accommodation. When I did the cardinal fields on her, her extraocular movement was intact. Moving on to the nose. The patient's nose was symmetrical. I didn't see any drainage, no lesions present, no moles. Also, I did palpate the nose to see if there was any tenderness around the sinuses area, and there was none noted. As for her olfactory test, I had her sniff a cotton ball that had coffee on it, and her olfactory nerve was intact. She was able to smell the coffee on both sides of the nose. As for ears, when I started assessing her ears, they appeared to be symmetrical. So I started off with the left side first. So the patient had no redness in the ear area. Her ears appeared to be an S shape. She did have one piercing on the left ear. There was no discharge present, no lesions. The arcle, the trachea, and the lobe appeared to be intact. So there was no abnormalities there. I did palpate around the arcle, the trachea, and the lobe in the mastoid process, and there was no tenderness noted. When I moved on to the right side, there was some drainage in the inner canal, and there was some redness on the right side of the ear. Also, the drainage didn't have any odor, but it was a concern. Also, when I palpated the arcle, the trachea, and the lobe and the mastoid process, it did hurt her a lot. So she had pain all in that area. My recommendation was for her to follow up with the physician once I gave him all the information, and for her to avoid going swimming until her issue is resolved. Thank you. Have a nice day.